The first panel is moderated by extraordinary Robin. Robin, if you'll come up. Farman Farmian. Finally learned how to say it. Thank you. Entrepreneur, rabble-rouser, author of the bestseller Patient as CEO, which I am in the process of reading. And as I admitted to Robin last night, I sort of thought I had it going on as someone who knows technology in the healthcare space until I started reading your book, at which point I was like, I know nothing. But when I'm done with the book, then maybe I will actually know something. So I turn it over to you in your very capable hands. You are miraculous, and I look forward to enjoying your panel.
So I'm like the president of the Alex fan club. I love her to death. So yeah, to give you a general idea, I am also 6 years away from AARP. Do not do the math. So I am a serial entrepreneur, worked on 12 early-stage startup companies, 3 on the founding team. But I'm also a very severe chronic disease patient. I've had 43 hospitalizations, 6 major surgeries, and 3 organs removed for a misdiagnosis. Can you tell? So at the age of 26, this is 7 years after they had taken out my entire colon freshman year of college, my doctors were telling me I was cured and put me on 80 milligrams a day of methadone. I went home that night and I said, no. I'm not going to live the rest of my life on very high-dose opiates. There's something else wrong. Fired my entire healthcare team, rebuilt it with me as the CEO, brought in the experts, got diagnosed correctly, put on a drug called Remicade, and went into remission overnight, literally within 24 hours after being a shut-in at that point for 3 years. So that's what my book is about, and it talks about the convergence of accelerating technology, really empowering the healthcare consumer or the caregiver to be the CEO of the healthcare team. So with that, I would love to bring up the panelists and come on up. Ronnie and Andy and Jordan and Marcus, and we will start talking. These are all experts in their particular domains, and I've been incredibly excited to do this panel. So what we're going to do is we're going to start with about 1 minute on who you are, and then we will kind of open up the panel and start talking. So Ronnie, would you start?
Thank you, everyone, Robin and all, for having me. I'm Ronnie Zeiger. I'm a caregiver. I'm a patient. I'm a part-time urgent care doctor, and I'm a full-time entrepreneur. I run an organization called Smart Patients, and we build and run online communities for patients and families to support each other.
Jordan?
Thank you. My name is Jordan Schlein. I'm a full-time doctor and a full-time entrepreneur. I try to look at the models of healthcare today as completely broken. And as I look at the universe of caregiving as a physician, is I'm trying to re-engineer processes that honor people, whether you're a patient, a doctor, a nurse, a caregiver, everybody, because you have to look at the system holistically. I accidentally started a software company about 6 years ago because I just did an experiment in my office to see if some technology would work, and it didn't. And so now I've kind of been immersed in the digital health world for about 7 or 8 years and have learned a lot of the lessons of that world.
My name's Andy Cohen. I'm the founder and CEO of a website called caring.com. I was a caregiver caring for my mom who had lung cancer back in 2006, and I kept going online trying to figure out how to care for her better, and I found lots of wedding planning sites and lots of baby sites, but no sites for caring for aging parents back in 2006. So after my mom passed away, I raised $20 million in venture capital and launched caring.com. And we are now the largest site for family caregivers. 3 million caregivers visit the site every month. And so we have a really unique lens into what caregivers' issues are and struggles and impacts on health. And I did know that the answer to the question that it's Monday morning that's the biggest hit for when family caregivers, Alex's point, they're coming to caring.com during the day at work, struggling to balance work and caregiving. And so I'm very excited to hear everybody's ideas out there on how to make caregiving easier, because we know from our visitors that it's a real struggle. So hoping to hear some great ideas today.
And I'm Marcus Osborne. I work for Walmart, and I lead what's called the Health and Wellness Transformation Organization, which is the goal is pretty simple. We are trying to find ways to bring through retail more solutions that enable consumers to have more control over their own health. And particularly as you think about the challenges, and Alex talked about the challenges that caregivers are facing, that is a group that's sort of screaming for help. And so I think I think there's a great opportunity to think about non-traditional players in the healthcare space and the role that they could play in terms of supporting the caregiver. So I'm excited to be here today.
Thank you. So I would like to start talking with Ronnie, because I love Smart Patients, by the way. I've been on the site since it started, what, 2011, 2012, something like that? Yes. So you're seeing a lot about the social support between patients. So what are you seeing with caregivers? How can they get something out of Smart Patients?
Well, more generally, one thing that's been a huge, a steep learning curve for me is I have no training in how to interact with or take care of caregivers. That was not part of my clinical training at all. And frankly, not very well on the radar when we started building these patient communities. And we very accidentally started learning that in many of our communities, half of the members are caregivers who are there on behalf of a loved one. And the most simple observation that we've made, that I've been able to make, is how much unutilized resource we have in the individuals themselves. And this is something that's kind of news to the patient world, or rather to the healthcare delivery world, that focuses on somewhat asymmetrically saying we healthcare providers are the source of relevant information for you, and you just simply have to do what we say. Big untapped resource is how patients can learn from and support each other in between, in the 500,000 minutes that complement per year that complement the 100 minutes that they might spend with their clinician. Well, for caregivers, this is more of a no-brainer. And a lot of people come to our communities as a caregiver initially to try to help make sure that their loved one is getting the best care possible. The surprise to us, and sometimes to them, is that they're finding so many other caregivers and comparing notes and learning from each other how to cope and sometimes how to be a better caregiver.
Wow, great. Well, that kind of brings me to what you're doing at caring.com. What are you seeing that caregivers are not thinking about? What are they forgetting?
Well, I think one of the things, and we'll hear a bunch of these ideas, is they're thinking their parents are unhappy and suffering, and we've done a lot of surveys of caregivers who have this worry and seniors who aren't having this worry. So seniors, the kids worry about their parents being lonely. The data says the parents aren't lonely. They're worried about their safety. The parents aren't worried about their safety. So one of the big challenges is really helping the caregivers feel better about their parents as they are and not trying to force their values on their parents. But in terms of things most caregivers miss on nuts and bolts, it's legal documents. We did a survey, and only 8% of the caregivers reported that their parents had power of attorney for health directives, living wills and trusts. So the best thing caregivers could do for themselves and their parents is make sure their legal documents are in order.
All right, so I just want to frame this next question. Walmart, it is the largest corporation by revenue in the world with $482 billion in revenue last year. That's almost 3x what GE did, right? So you have access to a huge amount of consumer products. What are you starting to see in terms of putting sensors or tracking some of these consumer goods and utilizing that data?
Yeah, I mean, I think certainly the challenge as we see it is pretty simple, that I think the goal of the caregiver is to enable care at home to occur. But fundamentally, that is very difficult. So the alternative is to use an institution, because the institution is potentially easier, simpler to engage with. So I'm going to, maybe I'll send my mom to a nursing home instead, even though my mother would prefer to be at home. And so the challenge is how, what we're looking for are solutions that enable a caregiver to replicate the benefits that an institution could bring. How do you make caring at home simpler, more affordable? And so that's the challenge. I think what I would say is I'd highlight probably 3 areas quickly that we're seeing interesting advancements from a technological perspective. One is in the lab at home space. There's companies like Now Diagnostics, even a pivot that we're seeing from groups like Scanadu, who are enabling caregivers and the individual being cared for to be able to get the labs that they need, often on a daily basis, done at home, as opposed to having to have those done in an institution. So I think that's one. 2 is the emergence of what I call virtual care, which I want to distinguish. This is different than telehealth. Telehealth is in my mind, not all that interesting. Telehealth is just video conferencing with a physician. and it actually is dependent on provider access. Virtual care is about actually removing the provider from the equation and enabling the consumers to get the care that they need and get the kind of questions they need answered without actually having to have the provider there. Because the providers, because there are so few, we have a supply and demand challenge, the providers are actually a barrier. And so what you see are groups like Virtuwell, which was a platform delivered by Health Partners in Minnesota, or Zipnosis, or even here locally, a company called Lemonade, who are starting to deliver these decision support-based solutions to consumers and are looking for ways to actually apply them to individuals who have chronic illness and are more advanced in their disease. And the last, and you talked a little bit about sensors. There's certainly a lot going on around this concept of home monitoring. But the challenge that we have seen and that we've heard from our customers and then just consumers in general is that the current generation, they find challenging because what you're really asking somebody to do is add one more thing into their home, one more device, one more item, one more thing that I got to mess with. So it's viewed as clutter. What we're now actually seeing are groups who are doing really interesting things about leveraging existing solutions that are already in the home to actually support home monitoring. So for example, there was a company that I've worked with, that have essentially retrofitted existing home security solutions that had infrared sensors to use those same sensors to actually do monitoring of individuals in the home. Is there movement occurring? And actually being able to do temperature readings from a distance off those infrared sensors. So another company was a company being able to use the porcelain in a toilet to do sensoring. So essentially, use the toilet to say, is somebody using the restroom, and if so, can I get some data or readings about that use of the toilet? And one of the more interesting ones was a group that is using the refrigerator handle as a basis for being able to get some health information about an individual. And so you think about what that does is, if you can start to create an environment where you bring all those things together, it starts to give the caregiver peace of mind when they're not there. They can actually see, as the individual that I'm caring for, what's happening, are things okay, are they not okay, so that that it lowers your stress and makes you feel like the home is actually a much more natural environment to provide care.
It's almost essentially a feedback loop, essentially.
Absolutely.
Wonderful. And that brings me to Jordan. Jordan is definitely an expert in feedback loops. Fantastic physician if you're looking for a concierge doctor. Just had to do that. So what you're doing in feedback loops, think about the fact that 51 to 62% of healthcare costs are probably attributed to behavior modification. And when you're dealing with a patient and you have feedback loops, the patient's going to change their behavior based on the fact that they know somebody is watching them. Now, how does this get interesting when it's in fact the caregiver that's getting the feedback loop? They're the one who is interacting with the physician or any of that kind of stuff, and the one who is in control of the patient or the one who is monitoring the patient.
Yeah, so I'm a big fan of systems theory, and if anybody wants to read a great book, it's called The Systems Bible by John Gall, who was a pediatrician who was really flummoxed by observing hospitals and doctors and patients and how as soon as you put a human into a system, it usually breaks. And then started studying how humans and systems interact. And one of the things he says is problems are not the problem, coping is the problem. And furthermore, all complex systems that work are usually based on simple systems that worked. And if you try to build a complex system from scratch, it's going to fail, just because of the human element. So on the subject of feedback loops, I mean, what's really interesting to me is if any of you have had a procedure or seen a doctor recently and then you went home, what is the reason you'll try to call the doctor? I mean, why does the phone ring in a doctor's office? This is the thing. This is the first question that kind of got me thinking about everything, which is why does the phone ring? And the phone rings because somebody's calling. And the reason somebody's calling is because they were at home after seeing the doctor, and something wasn't normal, or they didn't know the answer to a question, and so they thought about it, and then they went and asked Dr. Google. And they may, if they're lucky, have found smart communities, but they probably found that Dr. Google is an oncologist, and they have cancer. Or they thought they were concerned about something not being normal or not, and then they kind of got more anxious. And that anxiety of not knowing and getting information because Google doesn't know who you are, specifically, is all of a sudden it creates anxiety. That anxiety bubbles up to from your reptilian brain to your mammalian brain, and all of a sudden you need the answer. You're really anxious. So the phone call to the doctor's office is really this manifestation, this physical manifestation of an existential concern. Like, is this normal, is this not? So what was interesting to me is Well, how do we inform patients after they're home? And from my mind is on what's normal and what's not. So I've been really interested in this kind of feedback loop, and I built a system a long time ago that just was very simple, and this was the experiment I accidentally started a software company around, which was I set up a system that emailed all of my patients after they saw me with a condition, and it said, Dr. Shlain wants to check in with you, and then there was 3 things. I'm the same, I'm better, I'm worse than the day before. And all I was tracking was that. And what I found over time is that, first of all, patients loved it, and I had like an 85% response rate. It was asynchronous, proactive. All I did was I got a dashboard that showed me who was not on track based on what I would expected a recovery arc to look like. But then I realized that you can know, if, for everybody who's ever a hip replacement in here, like I know or had a thyroid removed or whatever, or new diagnosis of arthritis, I can almost predict with a degree of certainty over the next 3 months what your existential concerns are going to be, what's normal, what's not. So I built this narrative, I call it digital empathy, but it's a narrative platform that checks in with the patients after they've left, because I know what time it is, it's a week later. I know that they're probably thinking about these things, so I can educate them with a little bit of information on a regular basis. Subsequently, I can ask them how they're doing to track if they're trending the way I want them to trend, because I want the best outcome. What we've learned is that, the woman in Minnesota that had a hip replacement, her daughter lives in San Francisco, or her daughter lives, or caregivers live somewhere else. So we've included the ability for family to be part of this feedback loop so they can observe what's going on between doctor and patient and weigh in and start to affect positively like an outcome. If mom's not doing something or if she's not responding to the query, then that's the daughter's job to go find out from mom, hey, why aren't you answering the doctor's question? No news is not good news. I mean, in the old doctor days, no news is good news. I say no news is no news, and good news is good news, and we have to really, and what you find is that the human, the fundamental unit of humanity, as I see it, is a conversation. That's what we all do all the time. And so all these digital technologies and all these caregiving, we just want to communicate, and we want to get the right answer the fastest. So by lubricating communication around a goal is really what I find the most fascinating around this software that I built by trying to include all these people. But like I said earlier, complex systems only work because a simple system worked. And so I think as we start to go out into this new world of caregiving, we have to start looking at simple systems that kind of honor everybody, and then you can build out from there. Because what I see is a lot of people building a little siloed thing that, due to what you said, physicians are huge barriers. It's kind of a nightmare getting doctors to do anything, and there's a whole bunch of reasons for that. But I think that we have to honor their pain as much as we honor everybody else's pain. It's not like, okay, forget about doctors, let's focus on these guys, because you can't forget about us. I mean, I wish you could, but ultimately we're domain experts and we have the heuristics and the pattern recognition of what's good and what's not. And the last thing I'll say is, it's really important, we have 2 ears and 1 mouth and we don't use them proportionally. And I think that what's really important is that we listen to the preferences of our patients. And the caregivers ask what matters to you. It's not just what's the matter with you. And because that will inform how you take care of somebody. It's really quite simple. So I think listening and going back to the concept of empathy is critical in the endeavor of taking care of people.
So when a unicorn falls, especially here in Silicon Valley, I mean, the news go crazy and everyone is up in arms with what's going on with things like Theranos right now. And as a patient, I can't trust something like that because I'm like, well, some of my blood tests actually can mean life and death on certain medications. So we're a little bit scared now with things like the tiny little micro blood draws. But there is a company that you did mention called Now Diagnostics that Marcus is very familiar with. If you could tell us a little bit more about why would we start to trust some of these micro blood draws, and how would a caregiver be able to utilize a point of care diagnostic like that in the home?
Well, I think specifically what they're doing and what I'm seeing a lot of other companies do, which is you don't actually have to create something new. You can actually leverage something that has existed and worked for a very long time, but use it in a new way. And so the concept of a rapid test platform, the idea that you take a very small blood sample and put it on effectively the equivalent of a strip, and they're able to get some result, that's something that has existed for a long time. Anybody in here who has diabetes and does diabetic testing, you're essentially using a strip. If you've gone into a physician office and gotten any kind of rapid test run, you've essentially used the same platform. Effectively, the idea, though, was can you actually expand the capability of using essentially a fairly kind of old platform, but use it in a broader array of, for a broader array of things, and actually do it in the home. And so, if you think about most of what they're doing essentially is they've taken that basic rapid platform, which used to be only you'd only get it done in a hospital setting or in a physician setting. You can now they are now able to do that, or are in the process of sort of bringing that to the home, so enabling consumers to kind of do it themselves in the same way consumers have done it with diabetic strips and meters for a while. But the other interesting thing is similar to the meter concept is those tests used to be just on or off. You were pregnant or not, or you have the flu or you don't. But actually, the reality is if using technology like the phone, the camera on your cell phone, you can actually now start to get accuracy where you can get readings, and you can see it's not only am I pregnant or not, but I can assess cholesterol and determine what your cholesterol level is. I can do A1Cs that are clinical level. And so I highlight them as an example. They're one of a number of groups that are starting to kind of use what would be, frankly, tried and tested and technology that's been around for a long time, but using it in a kind of new way to enable consumers to engage directly. And I mean, your point is, yes, there's sort of some issues that have kind of popped up here recently, but the fundamental fact, and I'm a big believer in this, that if we can, that we have hidden labs and diagnostics behind the curtain of the provider. And I understand why, but the result has been we have a largely sort of monitored, undiagnosed population. And what the example I use, we know more about the health of our cars than we know about ourselves. And why is that? Because the auto industry has invested in putting monitors and sensors and all kinds of diagnostic equipment directly in your vehicle, and they allow you to see what the results of that. You don't have to go to your mechanic to have them do the diagnosis for you anymore. And so, so I think this concept of the empowered consumer and certainly the empowered caregiver, I think lab is one of those areas that to the extent we can start to free up that technology and bring it into the home, I think it has the potential to fundamentally transform how care is delivered. If we have smarter individuals and consumers who know more about their own health, it would be really, it may not be fun for the physicians who people are coming in because they've just had these tests run in their home and they say, I've got an A1C that's this, what are you going to do about it? But I think it'll force everybody in the system to change, and certainly groups like Now Diagnostics, I think, are at the forefront of that.
Now Diagnostics are going through and developing 37 tests right now, and they have one that is already FDA approved, I think, for pregnancy. Mm-hmm. Is that what it is?
It's going through the process right now.
Going through the process. But if you think about the fact that going to a lab for someone who is immunocompromised or is not very mobile, this is a very big deal, right? If, there were times when I'd have to get my blood drawn once a week for over a year. And that takes over 100 hours out of your life. So when we start bringing things like blood tests into the home, it's going to be a game changer, and you're going to be able to catch things much more easily. So Andy, what other technologies are you seeing that are accessible for the caregiver to bring into the home?
Yeah, so it's first inning, and if you're in this space, you didn't miss the window, because right now there's very little. We've done surveys of seniors, and very few are using any technology. The most prevalent ones are 10-year-old, I've fallen and I can't get up, sort of PERS devices. Mm-hmm. And all this great technology out there hasn't been adopted yet. So A, that's an opportunity, but B, it's also a challenge for people because seniors aren't rushing to adopt technology, and if it's active, they don't want to deal with it. So I think you have all mentioned passive things on the refrigerator door or other places, even on the TV, would be much better than trying to get a senior to use a tablet or something that they're not comfortable with. So I think the good news is it's first inning, and if you've got an idea, you're not too late. The bad news is it's not easy to get seniors to adopt technology. And in the last 12 months, 3 or 4 companies have flamed out that have been trying. Like Lively had a very sexy application for monitoring, and I think it was hard for them to get seniors to adopt. And so I think thinking of how to make it passive so that seniors don't have to do anything for you to get the benefit is absolutely the way to go.
The one caveat I would say, I mean, this is the fact is, I wouldn't want to characterize seniors as not being interested in technology. In fact, it has been for the past 5 years, fastest growing of all sort of consumer segments that exist, gender-based, ethnicity, race, age, fastest growing segment in terms of smartphone growth has been 65 and over, right? If you look at utilization of social media and other things, if you bring in our friends from Facebook, and what they'll tell you is fastest growing segment is that sort of segment. And so I do think it's about, you know, creating technology solutions that actually apply to their lifestyle. And so, but I think that's one of the things often we sort of hear, well, they don't want it. Actually, no, they do want it. They just want it in the way that they want it, not in the way you want them to want it. And I think that's the distinction, right?
I know that's the politically correct answer, but if you look at 85+ uses of smartphones and they're not using them, you know, they're using them for their phone, they're maybe checking email, but they're not using apps, they're not texting. So I think it's still early days. That will change for sure, but it's still early days.
I think when it's going to start to change is when it goes a lot more seamless. When you're talking about things like subcutaneous sensors or epidermal electronics, just bringing it in and no longer needing the patient or the caregiver to actively do something. You know, slap on the temporary tattoo for 2 weeks and then you just kind of forget about it and you've got the feedback loops, right?
Yeah, my grandmother called me, I don't know, a few years ago and said, can you get out to Michigan? You know, Grandpa's having some problems. And I went out there and he had 7 doctors. He had prostate cancer and he had 7 different doctors. They were all doing different things. No one knew what the other one was doing. You know, yes, sensors and yes, technology and yes, all this stuff, but sometimes just like simple principles, going back to what I was saying earlier is, like I asked him, I mean, I said, hey, Grandpa, like what does quality of life mean to you? Can we start to quantify that and qualify that in ways that are applicable to the activities of your daily life? He liked to play golf, he liked to drive, he liked to take walks, and he liked to have control of his bowels and his bladder. So, you know, sometimes all the technology and the whiz-bang cool stuff is interesting, but you may be solving for a problem that you probably shouldn't be solving for if you actually talk to the person and find out what it is that they want in their life and what are their goals and their aspirations, and going back to agency. And I'm a big fan of technology. I want it all to work. I'm somewhat pessimistic because I think that the technologists out there think that medicine is a people business that needs technology. It's not a technology business that needs people. And I think that's where they kind of get it wrong a little bit. But oftentimes, so I asked my grandfather, he said, look, if I can't control my bowels or my bladder, if I can't drive and if I can't play golf, let's start talking about hospice, right? That's what I want to talk about. And no one had that conversation with him. Nobody was, you know, I call it compassionate realism. Like, you have to be real. I mean, no one's making it out of here alive. And at some point, you have to have the honest conversation about what matters to you and what, you know, and I think that, and I have a lot of geriatric patients in my practice, like some of them have this fight and will to live and they want to see their grandkids, they have a goal. And I think that we have to focus this technologies around goals and also honor people's, you know, religions and cultures and politics and all these things, but I don't think there's an app for that. I think that requires a human talking to another human. And so I'm a big fan of the analog world solving a lot of these problems. And I know that the caregivers are trying to do that, but even caregivers, you know, they sometimes tiptoe on these issues and they don't address them head on. And I think most people like honesty.
Yeah, no, you've got to address them head on.
I think there's a beautiful principle that stems directly from your story. Although first I'm going to quickly digress. I just want to point out that a few minutes ago, when you said lubricating conversations, Alex Drain went straight to her phone, and I think she was looking up that domain on GoDaddy, and that's the name of her next company. So part of the problem is, I think, exemplified by the fact that your grandpa had 7 different folks doing things for him in a relatively uncoordinated way. And a corollary story, and then I'll share this really obvious principle. You know, when I'm seeing someone in the urgent care that has a cough that's been going on for a couple months and some things have been tried and it's not working, and it's time to refer them to someone with deeper expertise, do I refer them to the pulmonologist or the ENT doc or the gastroenterologist or somebody else? And the answer is, we don't know. That's the whole point. But there's no good solution today because we've built a medical system that's very defined essentially by organ system. And probably the 7 docs were organized somewhat in the same way. But our real world and our real lives are much more whole than that. And caregiving is probably the best example, where you ask someone what they need, and they're not going to say, you know what I need? I need a slightly higher O2 saturation. Or you know what I need? I need that H. pylori gone, because man, those fuckers in my stomach are really driving me crazy. Like, that's not how we think. We think about, can I spend quality time with my dad while we still have the opportunity? Do I have, how many hugs did I get from my kids yesterday? Not enough, because I was with some of you guys last night. Complicated trade-offs. No offense, no offense. I think I did the right thing. And that's actually probably the most interesting lesson for me from building an online system that supports some aspects of this, is that we actually started with kind of the traditional horizontal, you got lung cancer and inflammatory bowel disease and et cetera. But we noticed that all these conversations that were happening, maybe half of them are really specific to a disease and an organ. But half of them are really complex, messy things about life. My kid is 14, and she's got IBD, and we're starting to think about college, and we need to decide, when do we transition from the pediatric specialist to the adult specialist. Turns out those conversations have almost nothing to do with inflammatory bowel disease. They have to do with agency and parenting and autonomy and fear and anxiety. And having the same conversation with a mom who has a kid with cystic fibrosis is awesome. And so part of this challenge and part of this opportunity is that there are organizations few and far between, like AARP, which think horizontally and globally, but we're living in a system that still thinks like there's an app for this category and a specialist for this category, and real people don't think like that. So coming back to perhaps lubricating conversations, we have to get a little more horizontal.
Perfect. Well, with that, I believe we are out of time, and I had an amazing time on this panel. So thanks, everyone, for coming out.
Thank you.